Despacio, despacio.
Hundreds of thousands of Americans cross over to Mexico every year to get various medical treatments, a trend known as medical tourism. Lately, this industry has been booming, with more and more people looking for medical care that's both affordable and high quality, but outside the US. What's really eye-opening is that Americans are traveling across the border for these very reasons, which raises a lot of questions about America's own healthcare system.
More than half of working-age Americans are struggling to pay for health care, even if they have insurance.
It would cost me like $10,000.
$10,000 for the dental work here in the US. Do you mind me asking how much it's going to cost you in Mexico?
About $1,000.
The United States boasts some of the world's most sophisticated medical treatments and facilities. Yet, despite spending more per person on healthcare than any other nation, a shocking number of Americans can't get the medical care they need. Many Americans can agree that navigating the healthcare system can be a complicated and daunting task, leading them to seek treatment elsewhere.
$5,000 just to have a doctor look at my broken collarbone. Just to look at my broken collarbone.
But why turn to Mexico of all places? What is it exactly that makes it such an attractive destination for medical tourists? The biggest selling point of Mexico as a destination for medical tourists is the fact that prices are much lower down south. Americans living near the Mexican border are now routinely crossing over for medical care rather than paying higher prices for similar services and identical drugs in the United States. While doctors and public health officials in the area have been aware of the phenomenon for some time, a new extensive random sampling of Mexican doctors along the border from Texas to California found that Americans now account for a quarter of their patients, and money is the greatest factor. In Mexico, seeing a doctor can be incredibly affordable. In fact, sometimes the cost is less than 1/5 of what Americans typically pay with their health insurance. A survey also compared drug prices for 7 common drugs in the United States and Mexico and found that on average, the same drugs cost about 3 times as much in the US. But what is the reason for that? You see, in the US, patients spend roughly double on healthcare compared to other developed countries, but they don't always see better results. This is partly because a lot of money goes into insurance companies, hospital administration, and other overheads, rather than directly to patient care. Consider this: about 9% of Americans have no health insurance, and even those with decent insurance are often subject to high copays and deductibles that add thousands of dollars to healthcare costs. On top of that, insurance companies sometimes won't cover certain treatments, like orthodontic procedures, labeling them as elective, meaning that millions of Americans must either pay out of pocket or go without care. Also, with record job losses and a continuing economic slump, Americans continue to lose employer-sponsored medical insurance at an unprecedented rate, forcing them into expensive COBRA payments of up to $12,000 a year, and declaring medical bankruptcies at a rate of $2 million per year, giving them more reasons to seek treatment elsewhere. In 2021, Americans paid about $433 billion for out-of-pocket medical and dental services. Meanwhile, in Mexico, private services are offered at much cheaper rates. Savvy employers in Texas, California, and South Carolina are joining this trend, investing in Mexican healthcare programs for their employees frequently, at 1/5 the cost of American health coverage. These plans are significantly less expensive for employers as compared to the traditional American medical insurance programs. Employees also save on deductibles and out-of-pocket costs, as well as prescription medication costs. And the fact that most hospital medical travel packages include extras such as travel coordination services, lab work, and hotel stays make medical tourism in Mexico much more desirable. The roughly 1 million Americans that travel there every year save between 40% and 65% on medical and dental procedures, according to Patients Without Borders. And the discounts can be significant. with procedures costing up to 80% less in Mexico. And that is because surgeons don't come with a high cost as they do in the US, which are savings they pass on to patients. That includes everything from lower costs for property and pharmaceutical drugs to lower salaries for medical staff such as nurses and anesthesiology providers. In general, many American individuals and families find that the expenses associated with healthcare put significant pressure on their finances, making a trip to Mexico all the more worth it. And while lower cost attracts many Americans to Mexico, it isn't the only reason. Mexico is building a reputation as a must-visit place within the expanding health tourism sector, known for providing high-quality care to both local and international patients. Over the years, Mexico has improved its standards of healthcare, something that hasn't gone unnoticed. About 10 years ago, the Mexican federal government licensed the Joint Commission Accreditation Standards, which are used to accredit US hospitals. This means that Mexican hospitals are now using the same standards used in hospitals in the United States. Aspiring physicians in Mexican institutions face a rigorous preparation process that culminates in an exam to study a specialty. The intensity of this process ensures that only the most qualified doctors are granted the opportunity to practice. And, as medical school in Mexico costs only a fraction of what it does in the US, some American students looking to train as doctors end up crossing the border, which goes to show the level and quality of medical training doctors undergo. At the same time, most of the major private hospitals along the border offer technology comparable to first world economies. In fact, some high-end private hospitals employ medical technologies that are more advanced than those available in the United States. The reason being, they can purchase technologies from Europe that have not yet been approved by the FDA. And the quality of care goes beyond healthcare, as medical tourism caters for patient travel and accommodation. Mexican hospitals are teeming with experienced medical tourism facilitators, hotels, resorts, and airlines to create discounted travel and lodging options for Americans coming to Mexico for medical treatment. These complete packages ensure that American patients get access to the best possible medical teams, but are also able to enjoy a stress-free recovery period. It also helps that healthcare providers in many leading Mexican hospitals catering to international patients are proficient English speakers. The assurance that language will not be a hindrance in understanding medical instructions, discussing treatment options, or seeking clarifications promotes a higher level of confidence among American patients. Various studies have rated medical treatment highly, both in terms of the quality of the care itself and the levels of satisfaction amongst customers who take advantage of it. According to research by the US Medical Tourism Association, the vast majority of American patients who have taken advantage of medical travel to Mexico rate their experience as equivalent and even superior to US hospitals and doctors. As far as the overall hospital experience goes, patient care is often more pleasant in high-end private Mexican hospitals as compared to those in the US. The emphasis on personalized patient care and the commitment to ensuring positive outcomes contribute to the favorable experiences reported by Americans undergoing treatment there. Because there is so much competition in this space, healthcare providers have to up their game and aim to impress those who are willing to jet in from thousands of miles away to seek treatment, making this a self-perpetuating process of improvement. From the moment of arrival to the completion of their treatment, the professionalism and dedication of healthcare providers in Mexican hospitals leave a lasting positive impression on patients, making quality care a key factor influencing the decision of many Americans to opt for medical treatment south of the border. Americans are also drawn to the extensive range of medical services that are available in Mexico. There are several prominent hospitals across the country that regularly work with medical travelers from all parts of the globe to treat all types of medical issues. Among the various services offered, Mexico is most renowned for its sophisticated dental care. So many Americans are making the trip across the border to see dentists from one small town in particular called Los Algodones, better known by its nickname, the Molar City. Los Algodones is no typical border town. It has far more dentists per capita than any city or town in Mexico, or the United States for that matter. In fact, it reportedly has the highest density of dentists in the world. By some estimates, just about 1 in every 15 residents is a dentist. The demand has become so great that websites have been created to help Americans make appointments with Mexican dentists before they leave home. The thousands of Americans traveling to Los Algodones every year, not only because dental care in the United States has become so expensive, but also because a growing number of US communities have few, if any, dentists. Adding to the problem is that an estimated 130 million Americans have no dental coverage, according to the National Association of Dental Plans, and this is mainly because Medicare doesn't cover routine dental care. Cosmetic surgery has also gained great popularity among American patients. Tijuana, in particular, has emerged as a popular destination for those seeking aesthetic procedures, offering a combination of high-quality medical services, experienced surgeons, and more affordable options compared to the United States. Despite the attractiveness of cosmetic surgery in Mexico, the field as a whole faces persistent negative perceptions and social stigma. Critics often highlight cases of botched surgeries, ethical concerns, and unrealistic beauty standards perpetuated by the industry, contributing to the skepticism surrounding cosmetic procedures. However, if you look deeper, you will find that there are numerous patients who were satisfied with their procedures despite the industry's bad rep over the years. It should be noted that in Tijuana, like anywhere else in the world, there are highly trained plastic surgeons and those with less skills and experience. Therefore, regardless of the country, individuals considering medical procedures should thoroughly research and choose reputable healthcare procedures to ensure a safe and satisfactory experience. There's no hiding that the two countries have some differences regarding the regulation of plastic surgery. In the United States, for instance, plastic surgery is regulated by the American Association of Plastic Surgeons and the American Board of Plastic Surgery, ensuring high standards of safety and quality. On the other hand, in Mexico, there is no such rigorous regulation, and for that reason, patients need to be careful when choosing their surgeon. In addition to dental work and cosmetic surgeries, which make up the lion's share of the market at the moment, Mexico is also a great place for those seeking cancer treatments, those with joint issues, muscle pain, cardiac troubles, eyesight complaints, orthopedic woes, and everything in between. It's this sort of diversity that positions Mexico as a comprehensive solution for various medical needs, making it an increasingly sought-after destination for medical tourists. The geographical proximity of the United States to Mexico is yet another factor that plays a crucial role in the decision-making process for individuals seeking medical care. With shared borders and easily accessible transportation options, Mexico has become a convenient destination for many Americans. Residents of Arizona, California, and Texas have long crossed the border to major Mexican cities such as Monterrey, Tijuana, Guadalajara, Mexico City, and Juarez for sophisticated medical care in state-of-the-art hospitals. Nearly half of all American citizens live within driving distance of the major Mexican hospitals regularly attended by medical travelers. For everyone else, there are frequent and inexpensive flights to the major destinations for medical tourism in Mexico, making it easy to get quality, affordable healthcare just a short flight or car ride away. Traveling within the same time zone and avoiding long-haul flights contributes to a more straightforward journey for patients. This convenience is particularly significant for individuals with chronic conditions or those requiring regular medical attention, as it minimizes the stress and fatigue associated with extensive travel. Adding to that, many of the facilities at which treatments of all types are offered are close to significant urban centers. So, after arrival, there is no need for a lengthy onward journey. Patients can get in and out quickly, and often recuperate back at home rather than having to hang around for any longer than is necessary. The appeal of recovering in a nearby destination with a favorable climate further enhances the overall patient experience, creating a balance between medical care and the comfort of a supportive environment. The closeness also facilitates frequent follow-up visits, enabling healthcare providers to monitor and manage post-operative care efficiently. So, in essence, the intertwined aspects of convenience and proximity contribute to the allure of Mexico as a preferred destination for Americans seeking medical treatment. The US healthcare system, while advanced, is known to have long waiting times for treatments or surgeries, a compelling factor driving people to seek medical treatment outside the country. Faced with delays, Americans are drawn to the more expeditious healthcare options offered across the border. Unlike the prolonged waiting times experienced in some healthcare systems, Mexico provides a more efficient and expedited approach to medical care. Whether it is elective procedures, specialized treatments, or routine healthcare services, patients often experience shorter waiting periods, ensuring that their needs are addressed in a timely manner. This timely delivery of care not only addresses health concerns more efficiently, but also aligns with the growing trend of medical tourism. Long wait times are not just an inconvenience, they are a public health disaster as well. According to a study published in Preventative Medicine Reports, delays in medical care may increase morbidity and mortality risk among those with underlying, preventable, and treatable medical conditions. Therefore, seeking medical treatment abroad can offer a faster turnaround, addressing health concerns promptly without extended waiting periods. The access to treatment in Mexico has also been made easier due to the efforts made by professionals and institutions on either side of the border. Collaborations between American and Mexican medical practitioners have fostered the exchange of knowledge, expertise, and best practices, which not only enhances the quality of care, but also builds a bridge of trust between patients and healthcare providers, assuring Americans of the competence and reliability of the medical services available in Mexico. In some cases, cross-border healthcare facilities and partnerships have emerged, allowing a seamless transition of patients between the two countries. The integration facilitates a smooth exchange of medical information, enabling continuity of care for patients who may be receiving treatment in both Mexico and the United States. Collaborative efforts often extend to the facilitation of medical tourism. Joint marketing campaigns, information sharing platforms, and coordinated efforts to promote healthcare services in Mexico can effectively reach potential American patients, an approach that serves to create awareness about the benefits of seeking medical treatment across the border. At the center of all these efforts are regulatory frameworks that govern cross-border healthcare. Regulations play a crucial role in ensuring patient safety, maintaining quality standards, and harmonizing healthcare systems. Over the years, bilateral agreements and accords have been established to streamline the legal aspects of medical tourism, providing a foundation for the secure exchange of healthcare services. So, we've seen all the reasons why millions of Americans are flocking to Mexico for treatment, whether it's affordability, convenience, or the quality of care offered by the country's medical tourism industry. Americans are constantly choosing to take that trip across the border. But is it really worth it? Traveling to Mexico for healthcare does not come without risks. Most Mexican border towns, where the highest concentration of medical tourism infrastructure exists, have a high level of criminal activity and violence. Tijuana, for example, is the most dangerous city in Mexico, with 138 homicides per 100,000 people. And, according to the UN, Mexico as a whole has a homicide rate that is 7 times higher than the United States. Earlier this year, a group of 4 American citizens traveling to Mexico for cosmetic surgery were kidnapped by armed men while driving into the city of Matamoros, just across the border from Texas. And, while 2 victims were brought back home, 2 were sadly killed, raising concerns about the safety of Americans seeking treatment in Mexico. While discussing these issues, it's essential to consider the significant number of people moving in the reverse direction each year. A simple comparison of border crossing numbers highlights the crisis in the US's commercial healthcare system. Data from US Customs and Border Protection shows that the monthly border crossings by refugees from Mexico and Central America have been between 20,000 to 60,000 in recent years. Contrastingly, in Los Algodones alone, almost 5 times that number of Americans, often referred to as dental refugees, are crossing into Mexico. This situation is so pronounced that one might argue there are more people escaping the US healthcare system than those seeking asylum from Central America. Still, if someone has complications after returning home from a medical procedure, it may be hard for their doctor in the US to learn the details about the care received during a trip. You see, undergoing an invasive procedure and then traveling exposes patients to a higher possibility of infection. In 2019, 11 Americans who had surgery in Tijuana returned home with dangerous antibiotic-resistant infections. Traveling long distances for medical care increases the risk of developing an infection due to being exposed to a new or unique type of bacteria or virus not common in the home country. Online forums are full of horror stories of quack surgeons botching surgeries or suspicious generic drugs purchased in sketchy pharmacies causing severe reactions. So, what do patients do to minimize the risks? There are numerous factors to be considered and measures to be taken by American patients to ensure their safety. Before traveling to Mexico for treatment, patients need to heed US government travel alerts about their intended destinations. Trip safety can also be enhanced if a medical tourism agent works with the patient. Hospitals or care providers often have someone to pick patients up at the airport and take them to their doctor's appointment or hotel. Patients should also do research on care quality before looking at prices. The practice of medical tourism is largely unregulated, and there are virtually no laws in place for the process. So, one needs to do their homework before embarking on a trip down south. Differences in healthcare regulations and standards between the two countries can be a cause for concern, so it's important for patients to ensure that the chosen medical facility is accredited, follows international standards, and employs qualified healthcare professionals. Patients are also encouraged to read reviews and testimonials from other patients who have undergone treatment at the facility. A reputable health facility should have positive feedback and a track record of successful medical outcomes. Understanding the legal landscape in Mexico regarding medical malpractice is essential as well. Patients should be aware of their rights, potential legal processes, and the recourse available in case of dissatisfaction or adverse outcomes. Lastly, effective communication is crucial in healthcare. So, language differences may lead to misunderstandings about medical history, prescribed treatments, and post-operative care. It would be best for patients to seek medical facilities with bilingual staff, or hire a translator to bridge the language gap. Traveling to Mexico comes with a lot of risks, but despite the warnings, thousands of Americans still make the journey across the border for treatment. What does this say about their healthcare systems in the US? Well, nothing good. You see, government action on healthcare has long been a source of political debate. Lawmakers have continued to debate ways to evolve healthcare policies, trying to subsidize the insurance market and lower drug costs, especially since that's the main reason Americans are seeking treatment elsewhere. The growing worry over healthcare expenditure has led to considerable research, and many suggestions aimed at cutting these costs or, at the very least, slowing their current growth rate. The complexity of the healthcare sector and the power of diverse private interests make any change challenging and politically difficult. One sure thing is that the urgency felt by both the public and government officials will keep the problem high on the public policy agenda. If people are willing to risk going to another country for procedures that are locally available, then something is definitely wrong, and those in power need to see that. The surge in Americans seeking medical and dental procedures in Mexico underscores a compelling combination of affordability, quality, and accessibility. The substantial cost savings act as a magnet, drawing patients across borders without compromising the quality of care. And as healthcare costs continue to rise in the US, Mexico's cost-effective medical services present an attractive alternative. Looking ahead, economic considerations are likely to maintain their prominence, influencing a broader spectrum of medical tourists. Also, as technological advancements progress, Mexico is poised to become a hub for cutting-edge medical procedures, further attracting Americans seeking innovative treatments. While currently known for dental and elective procedures, the future may see an expansion of the types of medical services Americans seek in Mexico. Specialized treatments and comprehensive healthcare packages may become more commonplace, offering a broader array of options for patients. Ultimately, the allure of Mexico for medical and dental needs highlights a change in healthcare-seeking behavior. The trend of Americans seeking medical procedures in Mexico is part of a larger global phenomenon, and that is the globalization of healthcare. As borders become less restrictive and international collaborations strengthen, the future may witness a more interconnected healthcare ecosystem, where patients freely choose healthcare providers based on quality, cost, and convenience, transcending national boundaries.